Next page, ma'am. The investigations, please.
Start. You know what is the station is all about? You know the
Yes.
diagnosis? Okay, let's
Yes.
start.
2 minutes not over.
She is knowing what she has to do. Let her start.
Uh,
Your
no,
examiner is very strict about the timings, right?
no, ma'am. Let 2 minutes be over. It's like few
Okay,
seconds left.
okay.
Start.
Hello, I'm Dr. Chaitra, one of the doctors in the clinic today. May I confirm your name and age, please?
Yes, doctor, I'm Catherine. I'm 42 years.
How may I address you?
Catherine is fine.
Hello, Catherine. I can see from your GP letter that you have a pain in the lower tummy from past 10 months and some issues with the waterworks. Am I correct? Do you have any other concerns?
Yes, doctor, exactly. I'm having this problem. I'm quite disturbed.
Okay. Catherine, I'll be addressing all your concerns. We are here to support you, and I'll be issuing the written information leaflet and the support groups in the end. Can I ask you some questions?
Yeah, sure.
Can you tell me in your own words how the problem is bothering you?
Yes, doctor, I was actually fine 1 year before, but now you know that what happened is that my waterworks is just bothering me a lot. I have to rush to the toilet. I'm having pain in my lower tummy, and you know that pain is more worse when I have not passed pee. When I pass pee, I feel I'm much relieved. So I'm quite surprised at what's going wrong with me.
Okay, I understand you have been lots of problems. Have you taken any treatment for this, Catherine?
Actually, some simple painkillers I have taken over the counter, but not any
Mm-hmm.
specific treatment. Yes, my GP has told me to keep the bladder diary, to keep some food diary, but I'm actually not exactly following that.
Mm-hmm. May I address why we are not able to do that? Can I ask you that, Catherine?
I was not knowing it is very important.
Okay, I understand, Catherine. I'll get back to it. Catherine, can I ask you a couple of more questions? Some of them may be intimate also. Is it okay?
Sure.
Mm-hmm. Catherine, do you have a pain while passing peeing? You said me. Does it have associated fever?
No, not at all.
Do you have pain during intercourse?
No.
Mm-hmm. What about your bowel works?
Pain with bowels, opening of the bowels, no.
Mm-hmm. What about your fluid intake? How much of water do you use? Do you use any fizzy drinks?
Yes, I drink a lot of fizzy drinks, coffee, and sometimes I eat chocolates as well. But I'm unable to figure it out whether it is related with it or not.
Yeah, I noted down, Catherine. We'll address it. Catherine, can you tell me, have you ever been pregnant before?
Yes, I have two kids.
Mm-hmm. Was it vaginal deliveries? Were there any issues with the
Yeah.
delivery?
Yeah, they're grown up. Yeah, it was a vaginal delivery.
Mm-hmm. Did you undergo all the exercises in the post-delivery? Was it smooth?
Yes, it was smooth.
Okay. How is your periods? Are they regular?
Periods are fine, yes.
Any other concerns?
In the periods, no.
Yes. Okay. Are you up to date with your smear?
Yes, my smear is fine.
Mm-hmm. What about any medical problems for which you are meeting your GP?
No medical problem.
Any allergies?
No allergies.
Any specific medications?
No, I'm not using anything.
Okay. Any surgeries on the tummy or down below, Catherine?
No surgery has been done so far.
Any family history of concerns, specifically high sugars or blood pressures or clots, anything specific?
Not any particularly, and I'm not aware about that, whether what my parents were having. But
Okay.
everything is
What do you
absolutely
do for a living, Catherine?
Yes, I am a teacher actually.
Are you well supported at home?
Yeah, that's fine.
Some personal question. Do you smoke?
Yes, sometimes.
May I ask how many?
Almost 5 to 10 in a day.
Any thoughts of cutting it down?
I don't think so. It's bothering me at all.
I understand, Catherine. I'll note it down. Um, Catherine, what about alcohol or any other drugs for recreation?
Alcohol socially only, but no drugs at all.
What's about height to weight ratio?
It's 25.
What's your blood group? Any reservations?
Blood group and reservations, no.
How
Blood
have
group
you
is A
been feeling in
positive
the
and no
past few?
reservation at all.
Okay. How have you been feeling in the past few couple of weeks?
Yeah, I'm quite upset because of this condition, that I'm a teacher and I have to rush to the toilet sometimes, and sometimes feel relieved after passing pee. So this is the troublesome.
I understand, Catherine. We have been through difficult times. We are here to support you. Please don't worry. I'll get back to it immediately and we'll address all the concerns. Catherine, I have gone through your reports. Thanks for all the information gathering. Would you like to add anything important?
No, it's okay.
We would like to examine you in the presence of chaperone for your general condition, blood pressures, and tummy, and down below for any discharge. Is it okay?
You want to examine me from down below? I'm not having any discharge, doctor.
Okay. Okay, no issues. We'll skip that. Then, Catherine, I have gone through your information, the test results which have come, and I have confirmed your name and NHS number. And we have the reports, the urine the routine which was done by the GP is absolutely normal. There is no
Mhm,
evidence of infection, Catherine.
mhm,
And I can understand from your information gathered that we have a condition in which the waterwork bag is getting irritated. This is how the waterwork bag is. It has some nerve fibers at the end that is getting irritated because of some things which are coming in the urine. And I'll address there are multiple reasons because of which it can happen. One of them is high caffeine intake, fizzy drinks, then having the urinary infections also, which we have ruled out not in your case. And also sometimes what is called as mm,
mhm,
some drugs which are being used, and
mhm,
also Mm, all these things, when the irritants are there in the urinary bag, this is when we call this condition as bladder pain syndrome. As you exactly said, the pain relieves on the voiding of your peeing of urine. So that is when the bladder capacity has come down. So, Catherine, as your GP has told, the first line of management for this condition is usually it goes in a stepwise manner. As you have tried simple painkillers over the counters, Catherine, the next line will be definitely to do what is called as bladder diary, which
mhm,
the GP has told. That will get us a clue how your bladder is holding the urine. Is it small? It's avoiding few frequent small amount of urine, and the capacity has come down. And what are the drinks you're using? And the first thing what we would advise you after that will be to cut down your fluids to 1.5 liters per day and cut down on the caffeine because that acts as a highly irritant, and also mm, take care of your stress levels. If it is too much of work at your teaching profession, please take care of it, and some alternative things. Am I clear so far, Catherine?
Yeah, but if things will not sort it out after that, then what I have to
Mm-hmm.
do?
Yeah, exactly.
Do I need any tests as well?
Yeah, Catherine, we'll be involving a team of specialists for this condition. If the things are not improving after the lifestyle modification, and we need to involve a team of doctors, including my consultant, the specialist in the water bag, it's called urologist, then the specialist nurse, and they will help you with what is called as doing one special test to see how the capacity of the bladder is and why it's behaving like this. Is it like it's called urodynamic test? Am I
Mhm.
clear? So that's right.
Is it currently required or not?
After the lifestyle modifications, we'll be calling you back after 4 weeks and see
Mhm.
whether you're doing better. In that case, we'll continue with bladder retraining exercises. Uh,
What exactly the bladder training is?
Bladder retraining is a exercise which the continence nurse will explain you, Catherine, wherein we'll be asking you to, whenever you have a urge to pass urine, we'll ask you to hold for some more time, maybe 10 15 minutes extra. Like that, the capacity goes on increasing each time you postpone the voiding. Am I clear so far?
Okay, all right. And if things will not sort out, then what is the next?
Yes, we have the medicines for that, Catherine. That is, one is, uh, actually, I'm getting confused, ma'am. Like right now,
No,
just
no,
one
no, no. You're doing very well. Please move on.
The drugs, I think it should be like
Okay, what
antidepressant.
after the
There are some
drugs?
medicine,
Okay, what
some
after the
medicine.
drugs? If drugs will not work, then what next?
Yeah, yeah. If the drugs are not working, definitely the team of doctors, including the local MDT, will decide upon. There are some injections which are available to calm down these nerves. They will be put under the visualization with the camera inside your bladder, water
Mhm.
bag area to calm these nerve fibers.
Mhm.
It's called Botox injections. And then
Okay.
like hydrodistension therapy. These are the things which are done in the tertiary hospitals,
Mhm.
which will help you with the recovery.
What is exactly the hydrodistension is?
Hydrodistension is gradually we give around a few. Actually, it is done to really almost destroy the nerve endings of the bladder fibers so that we don't have that recurrent irritation of the nerve fibers. Maybe around a liter of fluid is inserted.
Mhm. All right.
And we have to give those sertraline antidepressants in the first line, ma'am.
Mm-hmm.
That's
Okay.
it.
So what I have to do now?
And then we have the last option will be pre-sacral nerve to neurostimulation. These are some small pacemaker-like structures which are kept in the back of the tailbone, which will help
Mhm.
in relating these nerve signals which are going to the brain and causing such problems. So I'll give
Mhm.
you lots of information today. So I'll put it down, and this is the information. We'll document whatever we discussed today.
But what I
Please
have to do
start your
today,
diary.
what I have to do now?
Please start your diary today. It will be very
Okay.
useful. 2 days
Mhm.
of working and one on the weekend day will help you collect the information. And
Mhm.
we'll review with your bladder diary with my consultant in the next appointment in few weeks. And this is an information leaf letter. I will write back to your GP too. Thank you so
Okay.
much.
Right.
Yeah.
Thank you, doctor. Thank you so much. Thank you so much, Chaitra. It was very good, and you were not confused at all. You did very well, my dear. Why you
Mm.
were feeling that
I
you are
felt like I'm mixing up OAB with BPS, ma'am. The two
no, no,
flowcharts.
no, 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 no. You were not mixing at all. You did very well. Management plan was very accurate. Your communication was very accurate, and
Mm-hmm.
your whole management plan and taking the station forward was very smooth, right? But
Mm-hmm.
still,
Thank
I need, because I am today, I am here to make all the stations perfect. This is the
you.
reason I want to add some things, right?
Yeah.
First is this: the purpose of including urodynamic station is this: students usually feel so much difficulty in explaining the things about urodynamics, right? Why? The thing is that they have not prepared single lines for every step. These type of stations, like you're not stopping any medicine, you're not, your patient's life is not in danger, you're not doing anything that can put the patient's life in danger. Patient is having bladder pain syndrome. These pain syndrome type of things are basically the things where the patients are very, very depressed, where the patient's quality of life is hugely affected, right? They need a lot of support. Second thing is that your communication should be in this manner, that with a fixed time, by telling single line about each management plan, you just finish the flow chart. Everyone has, I know that, who reached at the step of part 3, they are very good in knowledge. They know the complete flow chart of the GTG about the bladder pain syndrome. Now I will tell you the trick that how you will complete the flow chart within minutes without wasting any time and without leaving any ambiguity in the mind of the role player, right? As I have already told you, see, you have asked about pain. Fever, I do not get that why exactly you asked about fever, but probably because of UTI, you were asking about the fever, right?
Yes, ma'am.
Yes. Then the thing is that you asked me about blood group and reservation, which I think is that until and unless she need any huge surgery, blood group and
Okay.
reservation is not very required in urodynamics, right?
Okay.
Second thing is that you have asked me that whether I smoke cigarette. I told you 5 to 10, and you have not like this is included in patient safety. Whatever the number of cigarettes she's consuming, whether even if she's consuming one cigarette, being a healthcare professional, you cannot encourage any patient to yes keep on using, continue using your one cigarette daily. No, being a healthcare professional, you have to say to the patient that, Catherine, I want to make a little suggestion over here. Sometimes smoking can have bad effects on your waterworks and on your general health as well. So, if at some point in life you make up your mind, I can connect you with a stop smoking services. That is it, right? We are not forcing her. We are not saying her that right now you should stop smoking. No, not at all like this. But being a healthcare provider, we cannot keep quiet if she smoke 5 cigarette, 10 cigarette, even one cigarette, right? This is not our task to be done. Being a healthcare provider, we have to tell every patient that it has long-term consequences on your health. If you at any point in time you make up your mind, we can connect you with a healthcare with a stop smoking services, right? No medicine you have asked. Then you have asked about allergies. Periods you have asked. Okay, periods you have asked. But let me tell you that this particular station, actually, you know that the chronic pain syndrome, bladder pain syndrome, all these pains which are not real pains, all these pains which are have psychological connections, these are very
Okay.
favorite by the Royal College, right? Why they are favorite? In every exam, they include one station, at least these type of stations, because these will be the station with the lay examiner, where any kind of head of society will be sitting there and she will be or he will be judging you in this manner, that how kind you are, what is your way of expressions, how easy you are in your communication. This is the station more about communication with patient as compared to the patient safety, right? Definitely patient safety factors are still there, but why communication matters over here? Because if in the exam you will start your flow chart from the beginning and you will only reach up to point 1 or 2, when you will come out you will be very disheartened that I know the full flow chart, but I have not covered full chart. Why I have not covered full complete management? Patient was again and again asking me that if my condition is not relieved, what you're going to do with me? Slide is not moving. Yes, Ravneet, just a minute. I will move it. I was just speaking my own. I will move it just a minute. I have, don't worry, I have made full slide with with every point. Just a minute. Yes. Now listen, in the bladder pain syndrome, we will start with introduction, right? This is your, I was talking about something before Ravneet talked to me about the slides. Okay, let's see.
Ma'am, chronic
Flow
pelvic
chart.
pain,
Flow
the
chart.
examiner,
Yes, yes.
flowchart 1.
So I
Yeah.
will tell you single liner about every point so that flow chart will be complete in 2 minutes, right? Listen, first of all, we will just in a routine, we will say, I am Dr. This. May I know you confirm your name and age, please? Now, these type of chronic pain type of situation need your extremely kind voice, extremely sympathetic tone. Like you try to do the acting with your study buddy in this manner that in these type of stations you become very mild tone, right? May I know, Catherine, that what is bothering you exactly? I can understand. As soon as she will mention that I'm having this pain, immediately definitely you will say, I'm very sorry, I can understand you're passing through a very difficult time. Make your voice up and down and say that I can understand you, this situation is very difficult for you. You are a teacher, oh amazing, that's such a wonderful job, but this condition is making your life very difficult. But don't worry, this is a situation that many patients are going through and we have the management options for that, and these will definitely work for you. Along with that, give her a hope that you will become fine after the management, right? Although these conditions can take some time, longer time to recover, but still patients recover after that. Now in the information gathering, this is an easy station to get fail in the information gathering, because its information gathering is a long list, because this is a condition which need its diagnosis needs exclusion of many things. Until and unless you will exclude the condition, you cannot make the diagnosis of bladder pain syndrome. Please mute your mics. Okay. So until and unless you will complete the differential diagnosis in your information gathering, you cannot say that, yes, you are having the bladder pain syndrome, right? So can you tell me more about your concern? Since how long it has started? Have you noticed that any food, any drinks are aggravating it? Anything which is relieving it, right? Any relationship with the diet? And the guideline has told us that we have to score any type of pain from 0 to 10. This is not my idea. This is not examiner's idea. This is not your idea. This is idea given by guideline. We cannot reject it. We have to follow the guidelines. We have to follow the protocols. I'm sorry, Catherine, but please, can you score the pain for me? 0 being the mild and 10 being the highest. Okay. Do you feel that pain is getting better after emptying the bladder? This is the conclusion for the bladder pain syndrome. Now start making differentials. Do you feel better after voiding? Is there any blood? Is there any bulge down below? Do you feel pain with the periods? Do you feel burning? Do you leak while cough or sneeze? Any history of any type of raise given in the past? Right? Have you ever been diagnosed with a condition in bowels? Ravneet has asked about the bowels. Now, this is a very, very important point to talk about quality of life. I can understand that this condition has really, really affected your quality of life. Instead of asking her that whether this condition has affected, just say, I can understand that, Catherine, this condition has really, really affected your quality of life. I'm so sorry for that. How about your sexual life? Is it really getting also affected? How is your relationship going with your partner? Past history, BMI, allergy, medical history. Explanation of situation. Ravneet has explained the situation very well, right? But try to make explanation shorter, because the marks are same. If you have, and these are not the real patients that you have to put everything in their mind until and unless they understand the situation very well. It's not your aim. Your aim is to pass the exam. And how you're going to pass the exam, you complete your station, right? This is the station in which patient is not asking so many questions to you, because she's expecting many things from you. These are the stations that when you have a lot of margin to speak, right? Now show your brilliance. Now show your communication skills. How you're going to show your communication skills? Speaking one line and covering everything. I will show you how you can cover the station in 2 to 3 minutes, because history will take a lot of time. You have to complete the history. Do not underestimate the power of information gathering, because information gathering can go easily fail if you are not worried about it. And if you say that daily I'm taking information gathering from 10 or 15 patients in my outpatient department, how I can get fail in information gathering? No, you can fail, because you are not knowing in every station. Questions should be on your tips, that these are the questions of this station. Pelvic organ prolapse, right? Pelvic organ prolapse, endometriosis, infection, SUI, cysts, stress urinary incontinence, radiation cystitis, renal stones, BPS. I have to cover 1, 2, 3, 4, 5, 6. If in 7 points you cover 5, it is enough. But when you will emphasize on this point, this says, I have to rule out differentials. I have to, if you are not asking the score from 0 to 10, you are taking it lightly, your impression about the information gathering is very bad, right? So never miss calculation of the score in syndromic pain type of the stations, right? Because layman examiner is sitting there. He is judging you that how sympathetic you are, how you are covering all the aspects of the patient. I have not mentioned here obstetric history, but you will mention obstetric, medical, surgical, everything. Explanation of situation in molar pregnancy stations, in Down syndrome stations. Please do not explain the situation in 1 or 2 pages. It will not help you in passing the exam. How well you have explained the situation, still it will give you only that mark. Only that box will be ticked. The rest of the boxes will stay empty if you will not tick them. So just give only importance to that point that it deserves. I have seen students explaining the Down syndrome and the molar in big paragraphs. This is meant by chromosome. This is meant by genetic factor. This is meant by this. No need to mention everything. You can pass exam easily without all this hassle. Only important thing is that right guidance and knowing in every station what makes you pass, what makes you fail. Lining of the bladder may get inflamed and can cause pain. Actually, no single test can diagnose bladder pain syndrome. You may need other tests to exclude that. And the team of specialists will decide about these tests, but probably they will need camera test to insert inside the bladder, urine test to see if there is any infection, right? And sometime bladder diary, the food diary, that everything that you have mentioned, right? But cystoscopy, urine test, examination, MDT will decide. It is very important to discuss about these things, right? Because definitely they will do something to rule out the cause. And when the urogynecologist will be involved, when the subspecialists will be involved, definitely they will do all these tests. We are not here to recommend these tests. We are here to put in her mind that sometime when you will be there will be a progress in your management. At some point in time, you may need these tests. Now, the first line of management is this. First line is that you should try to reduce the stress by different techniques. You should keep the bladder diary, food diary, so that we can see that what particular food, what particular fluid is aggravating the situation, and we can avoid that. You should avoid smoking, alcohol, and spicy food to make your quality of life better. Try to reduce stress by doing some exercises, mindfulness, meditation techniques, right? So that your quality of life can get better. I can understand that your quality of life is badly getting affected. Now, Ravneet, most important point is this. If you are not knowing exactly the name of medicine, no need to mention that. And even you are not going to fail that. You can only say that we can give you some simple pain reliefs. It's not necessary to mention that these are the stress relieving medicine. They will release some chemical, happy chemical, bad chemical, sad chemical. They will affect your nerve. Mechanism of medicine is not important to mention to the patient, because this is not her concern. She will not, like, it's not affecting her life, that in what way the medicine is getting effect, right? This is not her problem. This is our problem, that what medicine we are giving and how it is getting effect. What is the mechanism of the medicine? This is not the patient's problem. Address the patient's problem. What is his problem at that time? What she wants from you? She wants from you is a comprehensive, smart, detailed management plan. And to touch the name of medicine, or to touch that we can give you some pain relief medicine as well, is just a pretty simple to touch, right? Do not make your life difficult. Now, in every station, you discuss MDT before. But in bladder pain syndrome, this is the right point when you will tell the name of the MDT. Particularly clinical psychologists, never forget clinical psychologists, because all these syndromic type of conditions affect the patient's psychological health in a very bad way. So it is very important to discuss that clinical psychologist, pain specialist team, pain specialist nurse, all will be with you to help you in this pain. We acknowledge that pain is real, because many patients are suffering from the condition that nobody is acknowledging that they are having the real pain. But the pain is a real thing that they are having, right? Now, I have made these lines after like after like so much struggle in the urogynecology. I have made single lines for every management plan. What is bladder installation? No need to name the bladder installation. We can say some medicines that can be given into your bladder by the thin tube. That is it. That is it. Simple 4-5 words. We may need to give certain medicine inside your bladder with a small thin tube. These can be some numbing medicine. These can be some antibiotics, or to calm the inflammation. You may need some implant so that they can stimulate your nerve, that can be placed inside your body. We may need to do another procedure, which is called, in which bladder is stretched with a fluid. Simple line about the bladder distension. Bladder is stretched with a fluid which can aid the diagnosis and may temporarily relieve your symptoms as well. This is a simple line about it. No need to otherwise to explain a layman just leave the layman. Even to explain the bladder distension to a clinician is a difficult task. How you will explain? We will fill the fluid, we will insert the camera, then we will push the fluid. No, bladder is stretched with the fluid. Memorize, please take the screenshots and memorize these lines. I have collected them after a lot of effort, that bladder is stretched with the fluid, which can aid the diagnosis and relieve your symptoms. Neuromodulation, you will not take these names. If you want to take these names, it's okay. If you will miss it, then even it's fine. Another management plan is that you may need an implant to stimulate your nerves that can be placed in your body. Simple as this. Implant placed in your body to stimulate nerves. That is it. Surgical procedure may need to abnormal areas. If we find in the specialist center, we may need to treat them as well. Right? So in a simple manner, but do not forget the flow chart, right? This is a flow chart starting from here. If you finish over here and the bell will ring over there, you will be very disheartened at the end of the station. Previous slide. Aliza, don't worry, my dear, I will show again slide, but you know that I just need to discuss this flow chart. This is the reason. Okay, just go back to the this was the you were saying, right? I actually want to discuss the flow chart so that the purpose of the
Doctor,
session is
so can you mention about amitriptyline and cimetidine medicines?
You want to tell their description? You want to, if you want to give their description, you can say. Otherwise, you can say that we can give you simple pain relief medicines, right?
But ma'am, simple pain relief is the first line. In the second line, they are giving the amitriptyline.
These are you were talking about?
Yes, yes.
Yeah. We can give you some medicine to relieve your pain. These are amitriptyline. You want to tell the names as well? I don't think so.
So is it necessary to say about the mechanism, side effects?
Side effect is important to mention, right? Side effects are important to mention, but for mechanism of every medicine is not important to mention, right?
Okay.
Because this is not the purpose of the discussion and you will not have enough time. You have to cover applied clinic. To pass the applied clinical knowledge, you have to cover from here to here, right? If you will stuck over there and you will spend time in discussing 10, 5, 6 side effects or mechanisms of these medicine, then the lot of time will be taken. So touch every point and cross the flow chart from here to here, right? No need to stuck at any point. Start from here in a simple flow. We will start from very simple by the stress relieving, simple analgesics. There's some special medicine which are stress releasing as well. They can also be given. Sometime we will involve the pain team specialist or the clinical psychologist. They are experts in dealing with these types of pain. I can acknowledge that your pain is real and it's really, really bothering you. I can understand. If the pain will not be relieved by these manners, then we can move forward and we can give certain some medicine inside your bladder, right? They can help you in really very well. They can calm the inflammation, or we may need to sometime place an implant inside your body to stimulate your nerve. We may need to do the bladder stretching as well with the fluid that can release your pain. In 3 lines, I have covered 1, 2, 3, 4. No need to mention all these names, right? It is not possible. For patient, it's not matter. It doesn't matter that it's a posterior tibial nerve or it's a sacral nerve. For patient, it doesn't bother at all. Just mention the names that I have made this slide specially for you, right? That in a single line, you will mention all the things and the station will be done. This is about the bladder pain syndrome station, right? In whole the urodynamics, what you have to do is that make single line to describe everything. For every procedure, what I have done is that, because urodynamics difficulty is this, basically the explanation of the situation. Thank you, Ravni. Thank you so much, Aitra. Thank you, my dear. Actually, I'm also feeling bad that some students are unable to present, but definitely we will arrange other sessions as well. And we will definitely get back with a few more sessions, right? Just a minute. We will get back. Okay, now you people can tell me that how far you are in your preparation and what exactly you are feeling difficulty. Purnima, thank you. Rajni, thank you. Thank you so much. Thank you so much. Yes, definitely. I will get back with other stations as well. Anybody want to discuss it's their own difficulty in the for preparation? You people can see my screen, right?
The problem is not finding time to revise and listen to our recordings.
Mm-hmm. Actually, the thing is this, you have to revise the stations because as I have already told you that in every station, 2 to 3 points are very, very important, right? So when you will write those important points, make the sticky notes for every station, 3 important failing points. Write on those sticky notes and 1, 2, 3, 4, 5, 6. If you have discussed 6 stations, paste those 6 sticky notes on your tables, and on the next day do not revise whole station but revise those important points. That yes, Ma'am Asma has told us that in thrombocytopenia we are not going to forget red flag sign, we are not going to forget stopping the aspirin. We will definitely remember these points, and in the next day only remember those points which can make you pass or which can make you fail, right?
Got it. Nice.
Yeah,
Thank
Alita,
you.
definitely it's being recorded, my dear, and you will get the recording, right? And if anybody wants to join, our one-to-one course offer is also here for 14 stations, 28 and 48 stations. This is up to you as you feel convenient, right? Because exam is quite close, so we have only thank you so much for the AlphaMed platform that they have offered me the opportunity to talk to you guys. Ruma, I will share, my dear. Yeah, wonderful way of teaching. I know I'm born teacher, actually. I can't help it. Thank you, Eliza. Thank you so much, Roshna. Thank you, Ruma. Okay, my friends, so we will get back. These are the bundles that we are offering right now. Thank you so much from the backend team of the AlphaMed. Thank you so much for providing this platform. And please share the Telegram link. Insha, definitely. Definitely. AlphaMed support is here, and I will tell them that they will share. They will share.
Ma'am, I will do that next time.
Yeah, definitely. I'm so sorry. My apologies for those. Priya, yes, exactly. I'm a born teacher. This is the reason that I'm so happy while teaching, right? I never get exhausted. When you do anything that is your passion, that you never get exhausted. And okay, thank you so much, my dear. See you next time. And if any one of you want to take one-to-one course by me, these are the packages that we are offering. And for further details, just the team will contact with you guys in the Telegram group, right? I will share the Telegram group right now. Thank you, Fatima. Thank you. Yes, you can see the Telegram link is there, Chatra. You can see Chaitra. Everyone, you can see the Telegram link, and please get back to the team, right? Thank you for this session. Thank you so much for joining in. See you next time, my friends. Bye-bye. Thank you so much. Bye-bye.